Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. Type 3 hypersensitivity reaction occurs as a result of excess immune complex. That is nothing but antigen and antibody combination is called immune complex. Why there will be excessive immune complex formation? What happens in a normal individual? There will be formation of immune complexes as a result of foreign antigen, and these complexes will be eliminated with the help of complement system. Whereas here in type 3 hypersensitivity reaction, excessive immune complexes, which is not normal, will be formed because of excessive dosage of long-term antigen exposure, like exogenous antigens, bacteria, viruses in chronic infections, bacteria like Mycobacterium leprae, autoimmune diseases like autoantibodies against DNA like SLE, and in long-term exposure to environmental pollutants. Because of this excess dose of antigens, excess immune complex will be formed, which ultimately activates complement system, initiating an inflammatory response, leading to tissue damage. How this tissue damage occurs? It occurs by three mechanisms. First one, by activation of classical complement, where the byproducts of which mediate tissue damage, C3A and C5A. In my previous video on type 2 hypersensitivity, I told you to remember A for attractants, chemoattractants. Here another A for anaphylatoxin. These two will act as anaphylatoxins, stimulating mast cells to degranulation, leading to mast cell degranulation, ultimately inflammation. Here chemoattractants, after recruiting neutrophils will try to phagocytose this large number of immune complexes, but unable to do so. Instead, neutrophils release large number of lytic enzymes through its secretory granules. This is called frustrated phagocytosis. Because of its unableness to phagocytose, out of frustration, it will release a large number of lytic enzymes, which leads to tissue damage. Next mechanism is through activation of platelets by binding to Fc receptors. On platelets, these immune complexes will go on bind to Fc receptors of platelets, leading to its activation, which leads to microthrombi formation and release of vasoactive amines. These two will lead to tissue ischemia, ultimately leading to tissue damage. Next, last mechanism, activation of Hageman factor, nothing but factor 12, clotting factor. It leads to activation of kinin. Kinin is responsible for inflammation, leading to vasodilation and edema. Coming to types of type 3 hypersensitivity reaction. One is localized or Arthus reaction. Another one is generalized or systemic type 3 reaction. What decides whether localized or generalized reaction to happen? It is decided by the nature of immune complexes formed. In case of antibody excess, or antibodies are unequal amounts of antigen, large and insoluble immune complexes are formed. As antibody is dominant here, it will contain the antigen by forming large and insoluble immune complexes, which tends to localize near the site of antigen inoculation. It won't allow dissemination of antigen. thus producing localized type 3 reaction or Arthus reaction. Examples in skin, insect bite reactions, during allergic desensitization where repeated injections of same antigen are given for longer period. In lungs, following inhalation of antigens, exogenous antigens, bacteria, fungi, spores or proteins, causing extrinsic, because antigen coming from exogenous source, extrinsic allergic alveolitis. Example, farmer's lung, here it is due to inhalation of fungi, actinomycetes. Then bird fancier's disease, here inhalation of serum proteins in dust, from where it is derived from dried pigeon's feces. Now in reverse, antigens are in excess. Then small soluble complexes are formed which tends to travel through blood and gets deposited on various sites, producing generalized or systemic type 3 reaction. Here it enters the blood as it is small and soluble and travels and deposits in various sites. Example, if it gets deposited in blood vessel walls and leads to its inflammation, vasculitis, polyarteritis nodosa, Henoch-Schönlein purpura in kidneys on glomerular basement membrane, leading to glomerulonephritis, post-streptococcal glomerulonephritis, joints on synovial membrane, leading to arthritis in viruses like hepatitis B, C, dengue and rheumatoid arthritis. Some other examples: type 2 lepra reaction, connective tissue diseases like SLE, and finally serum sickness. It is not seen nowadays. Previously, for tetanus patients, horse anti-tetanus serum will be given as treatment. Then followed by that, 7 to 8 days later, patients will develop weakness, vasculitis, glomerulonephritis, edema, generalized lymphadenopathy. All these are because of type 3 hypersensitivity reaction, which is generalized type 3 reaction. Remember the channel name, The Average Dermadoc. Don't forget to like, share and subscribe. Thank you. Hasta la vista. До свидания.